all had to deal with some kind of wound care on our own, whether we simply fall down or cut our hands in the kitchen. But sometimes wounds just won't heal on their own and need special medical attention. So this episode is your guide to wound wellness. Joining us are registered nurse Sarah Farr and nurse practitioner Deb Hollingsted from Cumberland Healthcare. Welcome to Healthier You from Cumberland Healthcare. I'm Caitlin White. Sarah and Deb, thank you so much for being with us today.
Thanks for having us.
It's great to be able to share our vision with you. Thank you.
So Deb, I'll start with you. What types of wounds do you see in your center?
We see any type of wound that a physician or a patient would like us to look at. We will assess any wound and ensure that we can provide the best options. We specialize in diabetic foot ulcers, surgical wounds that have not healed, venous ulcers, burns, but we also do cellulitis, callus reduction, and lymphedema management. So whatever the provider or the patient wants us to look at, we will at least look at them and assess if we can do anything for the patient.
Great. And Sarah, do patients need a referral to come see you guys?
No referrals are needed to be seen in the wound clinic at Cumberland Healthcare. You can call directly to schedule without an order from your primary care provider or specialist. We often have same-day appointments available, so don't delay reaching out for care.
So we talked about the kinds of wounds that you see, but Deb, what types of treatment are then offered?
When we see the patient, we tailor the types of treatment to the type of wound that comes in. We have different options to choose from. Diabetic foot ulcers, we will debride the wound and get the slough or the icky stuff off the ulcer base, and then plan different regimens that will allow the best healing. We do the same with the venous ulcers and surgical incisions also. We do specialize in grafting, and we do wound vacs, and we have used larva, which is a medical maggot, to clean up wounds. So anything that we have that we think would best fit the patient, we will do that.
Gotcha. Well, I know this next question is probably a big question, but Deb, how long does a wound generally take to heal?
Typically, a wound that is basically stable, we see anywhere from 6 weeks to more. We do have some long-term wounds that will continually break open, and we will have to see you over years. But if we can do the grafting and most of the regimens, it's between 6 and 8 weeks. It depends on the patient's health status also.
Mm-hmm. Well, that kind of leads me into my next question for Sarah here. How often do you see patients?
Yeah, we see patients Monday through Friday and accommodate the scheduling needs of our patients. We're really great at coordinating multiple appointments. So if you're already going to be at Cumberland Healthcare having lab work completed or seeing your primary provider, we will schedule you in coordination with that appointment to lessen the number of trips you need to make for your healthcare needs. If wound care, such as a dressing change, is needed over the weekend, we make those accommodations and strive to make it a seamless process. Wound care services are also provided in our hospital unit.
Well, Deb, I'm sure we deal with wounds all the time, whether it's, something simple or, of course, something that takes a little more care. But when should a patient come in for a wound that hasn't healed? When do we know that it's kind of hit that next level of care?
We would rather see a patient as soon as possible because then we can heal it as soon as possible. If your patient waits until they think, like 2 to 3 weeks and it still hasn't healed, that will make the wound heal longer. So if you have any questions, you can come in, have us look at the wound and assess it and give you our opinion, and then we can go from there. But yes, as soon as possible.
Great. Well, Sarah, we're supposed to come in as soon as possible, but how long does it take to get an appointment with the Healing Center?
As long as it takes for you to call and make the appointment. We schedule same-day appointments. Our number here is 715-822-7306.
Well, my last question here is for both of you. I'll stick with Sarah first, but what would you say makes your Healing Center stand out compared to others?
Yeah, great question. In addition to our wound care services, we also provide care in our infusion and oncology bay. Collectively, these three departments make up the Healing Center, where you really are treated like family. It is more than just treating your diagnosis or condition. We want to know about your family, what you did over the weekend, where your next vacation will be. We are passionate about the care we deliver, and our goal is to make your journey and experience a positive and memorable one. There really is no better care than at Cumberland Healthcare, close to home.
Wonderful. And Deb, how about you? What would you say makes your center stand out?
I agree wholeheartedly with what Sarah said, but to add to that, we have a collaborative agreement and partnerships with local doctors. We keep your family doctor up to date on how your wound is healing. We also work with the podiatrist and orthopedic and surgeons and regular surgeons. If we need their services, we make a seamless transition to get you the best care possible. We have lots of avenues of different modes of treatment. We have various providers, so you can always be seen by a provider 5 days a week. So we're unique, and we're always here for you.
Thank you so much for all this great information, Sarah and Deb. We really appreciate your time and your insight and all the work you do at Cumberland Healthcare.
Thanks again for having us. Come see us at the Healing Center.
Thank you very, very much for the opportunity to share what we do with others. Thank you again.
For more information, visit cumberlandhealthcare.com. And if you found this podcast helpful, please share it on your social channels. And be sure to check out our full library for more episodes. This is Healthier You, the podcast from Cumberland Healthcare. Thank you for listening.